ನಮಸ್ಕಾರ ನಮಸ್ಕಾರ.
Good morning to all the Vivites again. I wholeheartedly welcome you all to this wonderful Ask the Doctor Facebook Live continuous series. And today is a wonderful Tuesday, and I'm back with a wonderful session on iCoffee, our awesome product for controlling or managing the sugar levels, my dear friends. So, a very good morning to all the Vivites again. Good morning, Zatin Gupta, Ratna Vishwakarma, Lakshman, Mr. Naresh, Sajida, Mr. Rajapandian, good morning. Mr. Vishesh, Mr. Vivek Gaud, Mr. Govindra, Mr. Gurmeet Singh, Varun Jain, Kanchan, Ashok, Ms. Charu Gupta, Ms. Trozen, Mr. Trozen, Aarti Devi, Shehnahas, Vijesh, Kundan Singh, Seema Sagar, Shesharao Kasani, Gina Fernandez. A very good morning to Mr. Pradeep Singh. Good morning to Subhash Sukumaran. Very good morning, Mr. Ravish, Mr. Akash, Mr. Suresh, Mohammad Khadir, Mr. Pradeep Singh, Mr. Asha, Miss Asha, Miss Nirmala. A very good morning, Sangeeta, Vijay, Shiv Kumar, Nisha. A very good morning to all the enthusiastic Vivites. I welcome you all to this wonderful session of iCoffee again. So this is a continuous Facebook Live series called Ask the Doctor. We really appreciate the flow of your questions or queries that we are receiving on a daily basis, and I hope your questions are getting answered as well, my dear friends. So as I told you, I'll be speaking about a short topic of iCoffee, which is a very important thing for your promotions in the market, especially during this the vulnerable COVID-19 scenario outside. And apart from that, I'll also be speaking about the publication of iCoffee. One of the other publication I spoke in the last Facebook Live series on iCoffee the last Tuesday. Today I'm going to speak about another publication of iCoffee. If someone doesn't know, there are two publications of iCoffee which are already mentioned on our website icoffee.in. If someone has not seen it, please do log into our website. I'll be letting you know how you log into our website and in which tab the publications are actually present. So as a general rule, I would like to tell you all that you can start shooting me your questions right now until I end my short topic on iCoffee. So once I finish this, I'll be able to take your questions so that we'll have a very good question answer session as well. So a very good morning to all dear Vivites. Again, I would like to tell you, if someone is not able to watch this Facebook Live, please do share them the link on your watch parties or on your home pages elsewhere in the social media platforms as well. I'll also be coming live every Friday night 10 p.m. Indian Standard Time exclusively for our US product iVed, which will be on Indus Viva INC Facebook page. So please do like and subscribe to the page if you have not done, so that you can see me live on Indus Viva US page as well. So please do connect this to your American Vivites if you have a network there. So a very good morning, my dear friends. Without wasting much time, I'd like to go into today's topic of iCoffee. As you all know that iCoffee, the tagline of iCoffee is very important, as we say. So it is controlling diabetes without compromising the authentic taste of coffee. This is very important. So what we normally do here is we give you a health supplement which not only gives you the taste or the sensories of coffee, but it also gives you the functional health benefits of controlling or managing diabetes, my dear friends. I hope you got my point clear. So we are giving you a dual product which can help you control your blood sugars. At the same point of time, it gives you the richness of the best coffee that you have in the world, my dear friends. So as I told you, I'll be talking about two important points today. The first thing is diabetes and its relevance to COVID-19. The second thing is the second publication that we have. See, these are the two important things that I'm going to speak today. See, there was one false claim which had appeared in some of the news blogs, as well as some of the news channels also aired it recently. The false claim was about the coffee itself. See, it was also aired in an international channel like CNN. See, they had told that coffee claims cure for COVID-19. This is a very, very bad thing actually which has happened. There is nothing like that. Coffee cannot cure a viral disease like COVID-19 actually. So if someone has a misperception, so I'd like to demystify this point by stating that coffee doesn't have any such role in killing or eliminating a virus. In fact, some of the news journals also placed an erratum later on stating that this news was fake. So there is nothing like coffee or caffeine have a beneficial effect in killing the virus. No, it cannot. So this was some of the news which was actually going around in India and elsewhere in the world stating that, and some of the distributors also had approached us stating that this was some of the news which was going around India as well, and is this really true? So absolutely I am trying to say that this is a false news. Coffee does not have any claims or benefits on COVID-19 by eliminating the virus or something. So please, this is a myth actually, so please don't believe such false claims. So I hope you got my point clear. So the second important article that I want to tell you here is from the newspaper Hindu on 14th of June. See, this is a very, very important article what I am trying to tell you here. COVID-19 may trigger new diabetes. See, first of all, India is actually called as the diabetic capital of the world. So we are the first rank in diabetes across the world if you see. So this COVID-19 may trigger a new variety of diabetes. See, this is one of the alarming things which is actually happening in the world now. The scientists believe that it is possible that the novel coronavirus may alter glucose metabolism that could complicate the condition of pre-existing diabetes or lead to new mechanisms of the disease. This is very important. None of us knew this thing actually, but now this particular deadly virus is actually causing a new kind of diabetes in the world. We really don't know how this happens actually. The scientists are now trying to figure this out. How would be this new variety of diabetes or even a pre-existing condition of diabetes can exacerbate here, so that this, the complications of this particular diabetes can increase a lot. We really don't know what is going to happen tomorrow, my dear friends. See, why I am telling you this point is, as I've previously told you, iCoffee is a holistic product which can protect your bodies from getting diabetes in future. See, COVID-19 is a kind of a situation where it can lead to a new generation of diabetes. Definitely by the use of our product, you can protect your bodies from diabetes. This is very important. You can have a preventive product in your hand. See, this is how your promotion strategy must be in the market during post-COVID-19 situations also, my dear friends. I hope you got my point clear. So going ahead on the same lines, what the researchers say is, so the virus can enter into the tissues inside the body, causing multiple and complex dysfunctions in the glucose metabolism. The virus can impair the glucose metabolism. So this can worsen the condition of pre-existing diabetes or lead to new mechanisms of diabetes. And especially what the scientists are saying is, based on the previous research, they have found that viral infections can precipitate type 1 diabetes, a chronic condition in which pancreas produces no insulin. See the complications here. Especially the people with type 1 diabetes have to be more careful, because this particular viral strain, if it is affected, can lead to a lot of complications in future, my dear friends. I hope you got my point clear. So going ahead, one of the other important journals which came, which it's called as Live Mint, which is one of the most famous online blogs, on 13th of June 2020 has published this report. COVID-19 may actually trigger diabetes in healthy people also. See, this is what is exactly called as, we are promoting a protective and preventive product in the market. This is what the relevance is. See, now COVID-19 may actually trigger diabetes in healthy people. Suppose if you don't have diabetes, suppose if one is actually suffering from COVID-19, you can definitely get diabetes in future, my dear friends. This can trigger diabetes in healthy people also. This is what the doctors internationally, they are telling about this dreadful disease called as COVID-19 and its relationship with another important pandemic which is going to burst in India in future, called as diabetes, my dear friends. I hope you got my point clear. So going ahead, there is a link which is identified between COVID-19 and the onset of diabetes also. This is also a very important thing. Now the doctors have identified a relationship between COVID-19 and diabetes. They have established a relationship between COVID-19 and diabetes. All these days, we were just speaking that diabetic people are more vulnerable to this particular COVID-19 infections. Well, this has been proved now. A mechanism has been established in the body, how the virus not only destroys your lungs. People thought that the virus will enter into your nose, it will destroy the lungs, it will cause pneumonia. Fine, it definitely happens. But along with that, what else is spoiled inside the body. Your intestines are spoiled, your fat is spoiled, your liver is spoiled, your pancreas are spoiled, your kidneys are also destroyed. All these things can be destroyed whenever the viral strains enter into your body, my dear friends. That is the main reason why this particular virus can lead to a lot of secondary complications. I hope you got my point clear. So going ahead, my friends, one important article I want to tell you from one part of India itself. This was appeared in 1 or 2 days before the newspapers was telling about this. More people with diabetes with late diagnosis. Why Ahmedabad has highest COVID fatality rate? Ahmedabad is having the highest COVID fatality rate. They have assessed in the city of Ahmedabad in Gujarat. Now they have found out that most of the people who have succumbed to the condition, succumbed to the disease, are diabetic population. Leave the external part of the world, leave abroad. You talk about India itself, in the state of Gujarat, where Ahmedabad, when they have studied the state, taken the statistics, diabetes has actually played a very important role in people suffering from this disease, my dear friends. They have clearly told that 84% of deaths were in high risk category, which is one of the most dangerous things, whereas above 60 years and above and 10 years and below. So these are actually the age groups where comorbidities like diabetes, high blood pressure were actually more in such people who succumb to this condition, my dear friends. I hope you got my point clear. Now the relationship has actually been established between this deadly viral disease and diabetes. But we have a very good armory in our hand called as iCoffee, which can definitely protect or maintain your sugar levels and definitely can protect your bodies in future days against this pandemic called as diabetes itself, my dear friends. So this is a very important thing that everybody needs to know. So going ahead, another important thing which appeared in an online blog called as AZ Central in the US on 14th of June 2020, they have also now cleared. See, they have also now been clear on this point, stating that diabetics are called as high risk group for COVID-19 infections. Again, I would like to reiterate this point. Diabetics are considered as high risk group for COVID-19 infections, my dear friends. This is actually told by CDC, which is the Centers for Disease Control, where people above 65 years of age with secondary complications of diabetes and hypertension, these are more people who are succumbing to the disease across the world, my dear friends. I hope you got my point clear. This is what the relevance between diabetes and COVID-19 is all about. Well, again, the other important thing which I really want to talk to you about here is the presence of caffeine in the other coffees that you are having. Caffeine, fortunately, caffeine is totally absent in iCoffee. You can consider iCoffee as a non-caffeinated product because we have removed caffeine and we have only the elements called as the polyphenols, which are nothing but the antioxidants. These antioxidants are very important for reducing the diabetes and promoting the longevity and health as well as well-being in a human being. So caffeine is a very, very dangerous thing actually. In small doses, caffeine can be a stimulant. Caffeine can trigger your responses, but in large doses on a regular consumption, caffeine can lead to a lot of psychological disturbances, psychiatric disturbances, especially like anxiety and depression can happen. So that is also one important thing. And caffeine can also precipitate or increase your heartbeat and heart rate. This is also very important, so that whenever you are drinking iCoffee, don't have to worry about the point of caffeine itself, my dear friends. That is one important thing that I wanted to tell you all. So as you all know that iCoffee contains a wonderful ingredient called as Salacia reticulata, which is otherwise called as Ekanayakam or Saptaranga, in which we have made an extract called as salcital. Salcital has been extracted from this Ekanayakam and it is has the reference. This Ekanayakam has a reference in the ancient textbooks of Ayurveda like Charaka Samhita, dating back to 900 to 700 BC, my dear friends. And it was written long back that Ekanayakam is a wonderful ingredient for maintaining or controlling your impaired sugar levels, my dear friends. I hope you got my point clear. So, as I previously told you, I would like to speak to you on the second important journal that we have published from the company's side, which you can find it on the website. So what you need to do is, you need to log into our website www.i-coffee.in. When you log into this website, on the right top corner, there is a validation tab. Please you click on the tab. Whenever you click on the tab, there are two documents which opens so far as the publications of iCoffee are concerned. I have spoken about the first document already in the last Facebook Live series on last Tuesday. Today I am going to speak about the second important publication that we have made. Suppose if someone has not seen this, please do see this. You can download this. The PDF document can directly download from the website, my dear friends. So you can use it for your purpose. Suppose if you are prospecting outside, or when you are having any kind of a prospection with the doctors as well, you can as well do it, my dear friends. So this particular article was published in a magazine, in a journal called as, it's an international journal called as Journal of Medicinal Food. So this was published in the year 2013, 2013-14. So whenever the trial of salcital, this was all about the trial of salcital. The salcital or Salacia reticulata, this actually, it promotes good sugar levels as well as reduces the cholesterol levels in patients with pre-diabetes. This was actually the clinical trial which I am going to talk about today. This is published. You can see the publication which is actually hosted on our website iCoffee.in. So let me tell you what exactly happened in this trial. So nearly 30 patients were actually taken for this wonderful clinical trial. It was done in a hospital. What exactly happened to these 30 patients were, these patients were actually pre-diabetic and pre-diabetic with increased cholesterol levels. Their cholesterol levels were increased, especially the bad fat. The LDL, the HDL, the VLDL and the triglycerides, these were impaired. So what exactly was done? So Salacia reticulata, I have told you about Salacia reticulata now. The Salacia reticulata is a wonderful tree. It's a small size tree in which the root of the tree we are actually using as an extract for this management of diabetes mellitus, my dear friends. So what we did was, the 500 milligrams of this extract of this plant was given to these patients, of 29 patients actually. 500 mg of extracts per day for a period of 6 weeks was given. So totally for a period of 6 weeks the clinical trial was done. So what exactly happened after 6 weeks was, normally by the end of 3rd week and by the end of 6th week, we take the sugar levels and the lipid levels of the patients. You don't believe, my dear friends, by the end of 3rd week itself, the sugar impairments, the impairment in the sugar levels were drastically reduced, especially the FBS and the PPBS, as well as the cholesterol levels, mainly the low density lipoprotein or the LDL or the bad fat, as well as the HDL or the high density lipoprotein or the good fat was elevated, and the triglycerides levels were also reduced drastically. And by the end of 6th week, it came to the baseline, which means to say that most of the patients, among 30 patients, almost 30 patients, everybody, the sugar levels came back to normal, as well as the cholesterol levels also came back within the range. I hope you got my point, which clearly says that iCoffee contains a very good ingredient called as Salacia reticulata, in which we have derived a patented molecule called as salcital, which is a very important ingredient for reducing your increased sugar levels, controlling your diabetes or managing your sugar levels. At the same point of time, it can also cut down your bad fat, it can enhance your good fat, and the same point of time it maintains your cholesterol and triglyceride levels also, my dear friends. I hope you got my point clear. If someone has not seen this paper, I would request you to log into our website, download the publication, and you can read the whole paper there, so that you can understand how exactly the scientific research happens on a product, and you can definitely promote the product in a scientifically validated and a logical way, my dear friends. I hope you got my point clear. So as you all know that iCoffee is a wonderful product which is suitable for all kinds of diabetes, either it is type 1, type 2, gestational diabetes or pre-diabetes. As I told you, diabetes is a palliative disease. Diabetes cannot be cured. Diabetes can only be controlled or maintained. The sugar levels can be controlled or maintained. Only then the human body can sustain itself. And as you know that iCoffee creamer or iCoffee black does not contain any sugar in them. You can at least take it for a minimum period of 3 months. As I previously told you, the wellness products always, for the better absorption inside the human body, will always require a period of 3 months to show its benefits. It can be easily taken with other medications if you are using it. It can also be easily taken with insulin molecules without any side effects. It does not lower the sugar as compared to the conventional anti-diabetic products. So the other important thing that I wanted to tell you here was, normally if you consume any other anti-diabetic product, normally the hypoglycemia is a very dangerous situation which is going to happen, my dear friends. Hypoglycemia is far dangerous than hyperglycemia. your sugar levels should drastically not fall down. That is a very bad thing. So iCoffee is a product which will gradually control your sugar levels, gradually manage your sugar levels without compromising the authentic taste of coffee, my dear friends. As I told you, the two important points, please go through the video again if you are having some doubts on this. The two important points, as I told you, the current situation of COVID-19 and that relationship with diabetes. As I told you, now the scientists are really venturing a lot in understanding the mechanism involved with COVID-19 and diabetes in future also in India. The second important thing is, please have a look at our websites as well as look at our publications also, so that you will get the better knowledge of scientific validation, so you can promote the product with very good scientific validation in the logical sense as well, my dear friends. So with this, I would like to end the short topic on this wonderful product iCoffee for this Tuesday. Thanks very much for your patient listening. So now it is a question answer time. So there was one question which was left pending last week, which I would like to take first. What is iCoffee's effect on absorption of iron and calcium? Absolutely, there is no effect on the absorption of iron and calcium. This is a generalized health supplement product which can be used as a dietary supplement, a generalized routine health supplement which can control or manage your sugar levels, my dear friends. It has no relation with absorption of iron or calcium inside the human body. So, and there is no study which has been proved or which has been done by us, which studies about the absorption of this elements like minerals inside the body, my dear friends. I hope you got my point clear. So I'll be taking up the questions for today. So today my colleague Miss Asma has collected the questions for me. So the first question of the day that I am taking here is, so can we use iPulse and iCoffee for both cancer and diabetes? Absolutely. If a person is having both the comorbidities, it is always important for you to consume iCoffee. This is very important because the comorbidities are different like cancer or anything, but controlling or managing your sugar levels plays a very important role so far as to sustain the human body, my dear friends. Definitely you can use in any such conditions as a generalized health supplement only. I hope you got my point clear. The second question that I am seeing on the screen here is, do we have to take iCoffee for lifetime? As I have told you before, the health supplement products have to be continuously used for a period of 3 months at least for better absorption inside the human body. As I told you today also, there are lots of relationships which are established between conditions like COVID-19 and diabetes, which we really don't know in a country like India in future. Different varieties of diabetes can occur. It is always better for you to consume a protective and a preventive product like iCoffee so that it can prevent you against deadly infections, viral infections or bacterial infections or any kind of fevers in future, my dear friends. So going ahead with the next set of questions, the third one that I am seeing on my screen here is, even after consuming iCoffee with water, a person is having acidity. So kindly suggest what else can be added. See, one important thing that the people are actually questioning us most of the times is, after the consumption of this product, the acidity levels are going. See, one important thing I would like to tell you, the first part you have only answered here. You can consume a lot of water. The other thing is, add more water to iCoffee. So for example, if you are adding 120 or 100 ml, please increase it to 200 ml of hot water. So this can also reduce the acidity a bit during the first 15 days of the consumption of iCoffee, my dear friends, not for prolonged use. I hope you got my point clear. So the next question that I am seeing here is, can low sugar patient consume iCoffee? Yes, because this is a sugar management supplement which can control or manage your sugar levels. It is always important for you to add a bit of sugar. You can add 1/4 teaspoon of sugar to iCoffee, suppose if you are a low diabetes patient, so that your sugar levels can come to normalcy. This is what can exactly happen when you consume iCoffee for a low blood sugar patients actually. So coming to the next question, what I have on my screen here, can iCoffee is to control sugar levels 100% and to stop medication completely after how many months? So I'll try to modify this question a bit. Suppose if the sugar levels come to normalcy, can we stop our medicines? That is one of the important questions that the people ask. Well, again I would like to reiterate the same point. Suppose if your sugar levels come back to normalcy, it is always important for you people to go to your personal physicians or doctors, ask their opinion, cut down the dosage of medicines, gradually taper the medicines and then stop it, my dear friends. I hope you got my point clear. So the next question that I am seeing here is iCoffee an immune booster also? Okay, I think I forgot to reiterate the mantra today. The mantra goes again like this. Again, all our Indus Viva products including iCoffee are frontline immune booster products. The same salsitol or Salacia reticulata has a lot of papers or publications which state that it is a very good immune boosting herb, my dear friends. So not only controlling or managing your sugar levels, it is also important to take care of your body by enhancing your immunity, my dear friends. I hope you got my point clear. So the next question that I am seeing here is iCoffee good for hemorrhoids or piles? Absolutely no, we are not positioning this product for such diseases. So the next question that I am seeing here is, after using iCoffee, diabetes is controlled, shall I stop using medicine? I think I have answered this question before. So the next question that I am taking here is, after the consumption of iCoffee black and creamer, sugar is not controlled, even including iPulse, kindly suggest. One thing I want to tell you, my dear friends, here, suppose if a person's blood sugar level increases after the consumption of iCoffee, which we have seen in around 5% of the people because of increase in the sugar metabolism inside the body. What you need to do is, you need to stop iCoffee in the mornings. Please continue iCoffee in the afternoons, half an hour before your lunch, and iCoffee in the night, half an hour before your dinner. Please do stop it in the morning times. This will reduce the sugar levels in those people only where the sugar levels have increased after the consumption of iCoffee, my dear friends. I hope you got my point clear. The second important thing what I wanted to emphasize here was, always iPulse must be consumed at a dose of 20 ml 2 times, half an hour before your food in case of diabetes people. Again, I would like to tell you one thing. iPulse is a product which is very good for tissue regrowth, which we call it as antioxidant activity, especially in diabetic complications. Do not use iPulse as a product for controlling your blood sugar levels, but only use it for preventing the complications of the disease, my dear friends. I hope you got my point clear. So the next question that I am seeing here is, one of the distributors' mother is suffering from diabetes, high BP, and also kidney problems. I would like to suggest both iPulse and iCoffee creamer in this particular condition, my dear friend. You can use both the products together for beneficial results. So I am taking the last question of the day. My customer is having dust allergy. He is consuming iPulse. Can he consume iCoffee also? Absolutely. Suppose if he is a non-diabetic patient, it is always suggested to consume only one sachet in a day, or he can also make it into half sachets 2 times in a day. So automatically his sugar levels can also be controlled, and it can be managed as a protective product or a preventive product in the future also, my dear friends. I hope you got my point clear. So these were the set of questions for today. So don't worry about it if your questions are left unanswered. Again, the next Tuesday, the iCoffee day, I'll be coming back with another important topic on iCoffee and the relevance of the present scenario and your promotional tools. So far as the products are concerned, I'll be coming back with the next set of questions. I'll be answering the set of unanswered questions next week. So thank you very much for your patient listening again. We really appreciate the questions posed by you on a daily basis. I hope your answers are getting solved as well. So please do shoot us more and more questions so that more and more scientifically validated and logical promotion can happen in the market, my dear friends. So thank you very much for this. So this is Dr. Balu Kolar here. So Head of Product Development and Training, signing off from Indus Viva Health Sciences, Viva Towers Corporate Office in Bangalore. Thank you very much for watching again. Have a nice day. Bye.